You sit on the edge of the examination table, holding your breath as the cold nylon cuff aggressively squeezes your upper arm, praying the digital numbers on the monitor will not dictate yet another miserable side-effect-laden prescription. That terrifying, breathless tightening sensation is not just physical, it is the profound anxiety of knowing you are trapped in a blood pressure management system that actually profits from keeping you chronically sick. You are caught in a deeply exhausting cycle of generic dietary advice, escalating dosages of synthetic chemicals, and the constant nagging fear of a sudden stroke or heart attack, all while the medical establishment actively ignores the true biological reasons why your arteries are screaming for help. You have undoubtedly sat across from a well-meaning physician who quickly glanced at your chart, frowned at your elevated numbers, and recited the exact same tired script you have heard for decades. Stop eating salt, lose a few pounds, and take this water pill every morning. They treat your rising blood pressure as an inevitable consequence of simply having celebrated your 60th birthday. But this is a masterfully crafted, highly lucrative illusion designed to keep you returning to the pharmacy. The hidden culprit behind your chronic hypertension is not merely a natural symptom of aging or a sudden lack of pharmaceutical drugs in your bloodstream. Instead, what you are experiencing is a catastrophic collapse of your vascular flexibility, an environment heavily fueled by severe intracellular mineral depletion, toxic dehydration, and the complete destruction of your body's natural vessel-relaxing molecules. The conventional medical establishment often completely ignores this root cause because teaching you how to physically heal your endothelial lining naturally does not generate recurring quarterly revenue for hospital networks. Selling you a lifetime subscription to a cocktail of daily medications that only mask the symptoms is a highly lucrative, smoothly operating machine. But today we are going to completely dismantle that machine. We are going to explore 5 deeply hidden, wildly dangerous blood pressure myths that the medical system uses to keep you dependent. And more importantly, we will uncover exactly how you can break free. By the time we finish our incredibly comprehensive conversation today, you will possess a clear, highly actionable, and rigidly science-backed roadmap to completely naturally dilate your blood vessels, reclaim your cardiovascular freedom, and restore the vibrant, energetic longevity you deserve. Before we dive deeply into these paradigm-shifting biological revelations together, I want to formally and warmly welcome you to our growing community. If you are thoroughly exhausted by the endless pharmaceutical runaround, completely tired of feeling like a passive victim waiting for your heart to fail, and ready to become the absolute authority over your own biological future, consider subscribing to our channel. We share the kind of deep dive, strictly science-backed senior health tips that mainstream doctors simply do not have the luxury of time to explain during a rushed 15-minute clinical visit dictated entirely by insurance billing codes. And because we are a dedicated, profoundly uplifting community that actively supports one another on this journey to vibrant longevity, I would love to know exactly who I am speaking to today. Drop a quick friendly comment down below and tell me where are you watching from right now and how many different blood pressure medications have you been told you absolutely must take. It is always so deeply inspiring to see proactive, intelligent people from all corners of the world coming together to completely take control of their health destiny. Let us begin our journey of truth by completely dismantling the most universally accepted, utterly devastating nutritional lie pushed by every major cardiology association in the world. A lie that literally guarantees your arteries will remain stiff and heavily inflamed for the rest of your life. The first dangerous myth is the absolute, unwavering medical doctrine that salt is the ultimate dietary enemy and that severely restricting your sodium intake is the only way to save your heart. For the last 50 years, older adults have been aggressively terrorized into eating incredibly bland, tasteless food, meticulously counting every milligram of sodium, and buying highly processed, chemically altered low-sodium products. The medical industry completely fails to explain the brilliant, highly complex biological physics of human electrolyte balance. Sodium is not a poison. It is an absolute, non-negotiable biological requirement for life. It is responsible for firing every single neuron in your brain and initiating every single beat of your heart. When you severely restrict your sodium intake to the incredibly low levels recommended by standard hospital guidelines, your body goes into a state of massive physiological panic. It activates an emergency survival mechanism known as the renin-angiotensin-aldosterone system, or REAS. This biological alarm system forces your kidneys to desperately hoard whatever tiny amount of sodium is left in your blood, and it does so by aggressively constricting your blood vessels and actively trading away your precious potassium. This massive vascular constriction actually drives your blood pressure violently upward and significantly stiffens your arterial walls. The clinical science exposing the absolute failure and profound danger of this low-sodium approach is undeniably terrifying, even if it threatens the entire foundational curriculum of modern cardiology. A massive, heavily peer-reviewed, and deeply rigorous meta-analysis published in the prestigious American Journal of Medicine evaluated the exact health outcomes of massive populations and revealed a truly staggering biological statistic. Individuals who strictly adhered to a highly restricted low-sodium diet actually experienced a staggering 37% increase in cardiovascular mortality compared to those who consumed a moderate, normal amount of natural salt. Let me repeat that so it permanently alters your understanding of standard dietary advice. Actively forcing your sodium levels to rock bottom aggressively accelerated heart attacks and cardiovascular death by over a third. Imagine your intricate cardiovascular system as a beautifully complex, high-performance engine. Severely restricting your salt intake is exactly like draining all the essential lubricating oil out of that engine, causing the internal pistons to grind together, overheat violently, and ultimately seize up under the massive, agonizing friction. Your incredibly simple, entirely life-changing, actionable takeaway here is to aggressively reject the fear-mongering surrounding natural salt. You must permanently throw away the toxic, highly refined, heavily bleached white table salt that contains chemical anti-caking agents and entirely replace it with a high-quality, mineral-rich alternative like pure Celtic sea salt or pink Himalayan salt. Furthermore, you must fundamentally shift your entire nutritional focus away from merely avoiding sodium and intensely focus on massively increasing your dietary potassium. Your blood pressure is controlled by the delicate ratio between these two minerals, not just the absence of one. By deliberately eating massive amounts of potassium-rich foods like wild-caught salmon, fresh avocados, dark leafy greens, and properly prepared squash, while generously salting your food to taste with natural minerals, you effortlessly balance your cellular fluids, immediately calm your nervous system, and allow your desperately constricted blood vessels to finally, beautifully relax. Moving smoothly along to our next heavily guarded, highly profitable clinical secret, we must confront the terrifying reality of how treating the symptom actively causes a cascade of entirely new, life-threatening metabolic diseases. The second dangerous myth is the deeply entrenched belief that standard first-line water pills, known as diuretics, are completely harmless, mild medications that simply help you urinate out a little extra fluid. When you are first diagnosed with mild to moderate hypertension, the absolute first thing a doctor will do is reach for their prescription pad and order a cheap thiazide diuretic. They explain that by forcing your kidneys to excrete water, the overall volume of your blood decreases, which logically lowers the pressure inside the pipes. But human biology is infinitely more complex than simple household plumbing. What they completely tragically fail to explain to you is that when these powerful synthetic drugs forcefully flush water out of your kidneys, they aggressively and indiscriminately flush out massive, life-sustaining amounts of intracellular magnesium and potassium right along with it. Magnesium is the master relaxation mineral of the entire human body. It acts as the vital biological key that unlocks the smooth muscle cells lining your arteries, allowing them to physically dilate. When you chemically strip your body of magnesium every single morning with a tiny white pill, your arteries literally lose the biological capability to relax, becoming completely stiff, rigid, and deeply prone to microscopic tearing. Furthermore, magnesium is absolutely required for your cellular insulin receptors to function. When you deplete this vital mineral, your cells stop responding to insulin, plunging you directly into severe metabolic dysfunction. The unvarnished truth about this deadly pharmaceutical cycle is perfectly documented in massive clinical trials that the medical establishment desperately tries to sweep under the rug. In a highly rigorous, incredibly exhaustive clinical initiative published in the world-renowned Journal of Clinical Endocrinology and Metabolism, leading researchers analyzed the long-term metabolic effects of standard thiazide diuretics on older adults. They discovered an absolutely undeniable, completely terrifying physiological reality. Patients who regularly took these standard blood pressure medications experienced a massive drug-induced depletion of intracellular magnesium, which directly resulted in an astonishing 30% increased risk of developing severe insulin resistance and full-blown type 2 diabetes. You are literally being prescribed a medication to lower a number on a monitor, and in exchange, the drug is actively destroying your body's ability to process blood sugar, guaranteeing that you will become a highly profitable, lifelong diabetic patient. Picture yourself sitting in a small wooden rowboat that is taking on a tiny bit of water. Taking a daily synthetic diuretic is exactly like using a heavy motorized drill to aggressively bore a massive hole directly through the bottom of the boat to let the water drain out, completely ignoring the fact that you are fundamentally destroying the entire structural integrity of the vessel and guaranteeing it will eventually sink to the bottom of the ocean. To physically harness your own metabolic power and escape this deeply dangerous cycle, your actionable takeaway is to immediately begin fiercely defending your cellular minerals. If you and your doctor determine you must temporarily remain on a diuretic, you must aggressively demand a completely different, highly advanced blood test at your next appointment. Stop letting your doctor order a standard serum magnesium test, which is virtually useless because only 1% of your body's magnesium is stored in your blood serum. You must explicitly demand a magnesium RBC test, which measures the magnesium physically inside your red blood cells. To actively repair the pharmaceutical damage, you must daily supplement with a highly bioavailable form of this vital mineral, specifically magnesium glycinate, or magnesium taurate, taking roughly 300 to 400 milligrams every evening. This specific targeted intervention rapidly restocks your severely depleted cellular reserves, naturally dilating your rigid arteries and forcefully protecting your body from drug-induced diabetes. Now we arrive at what might be the most deeply fascinating, entirely dismissed, yet structurally profound biological reality of how your nervous system actually dictates your cardiovascular health. Our third dangerous myth is the incredibly pervasive medical lie that white coat syndrome is simply a harmless, fleeting bout of nervous anxiety that can be completely ignored. You know the exact feeling. You check your blood pressure at home, and it is perfectly normal. But the second you step foot inside a highly sterilized, overwhelmingly stressful clinical environment, your heart rate accelerates, your chest tightens, and the monitor flashes a terrifyingly high number. The doctor usually smiles condescendingly, tells you that you are just a little nervous because you are in a hospital, and either completely dismisses the reading or worse, prescribes you heavy medication based on that single terrified spike. What they completely fail to understand is the brilliant, highly complex, deeply primal survival mechanism operating inside your brainstem. White coat syndrome is not just silly, trivial anxiety. It is a massive, incredibly violent activation of your sympathetic nervous system, your body's ancient fight-or-flight response. When your brain perceives the clinical environment as a threat, it immediately dumps massive, overwhelming amounts of cortisol and adrenaline directly into your bloodstream. This chemical flood aggressively constricts every single blood vessel in your body to prepare you to fight for your life. If your nervous system is so deeply dysregulated and fragile that simply sitting in a chair in a doctor's office causes a massive cardiovascular event, it means your body is chronically living on the absolute razor's edge of a sympathetic storm, and completely dismissing it is biologically catastrophic. The clinical evidence exposing the absolute danger of ignoring this physiological alarm bell is simply staggering and impossible for honest, data-driven cardiologists to ignore. A heavily peer-reviewed, extensively monitored, decade-long clinical trial published in the highly esteemed Journal of the American College of Cardiology evaluated the exact long-term cardiovascular outcomes of patients displaying this exact clinical phenomenon. The researchers definitively concluded, with absolute scientific certainty, that completely untreated white coat hypertension is not benign. In fact, it actively increases an older adult's long-term risk of suffering a massive, fatal cardiovascular event or stroke by an astonishing 36% compared to individuals who maintain a calm, regulated nervous system in stressful environments. Dismissing this spike is literally ignoring the absolute loudest distress signal your heart can possibly send. Imagine your cardiovascular system as an incredibly expensive, highly advanced sports car parked in your driveway. Dismissing white coat syndrome is exactly like completely ignoring a hypersensitive, constantly blaring car alarm that violently goes off every single time the wind blows, completely failing to realize that the endless blaring alarm is actively destroying the internal wiring and permanently draining the entire electrical battery from the inside out. Your profoundly simple, entirely life-changing, actionable takeaway here is to completely take back the diagnostic power from the clinic and actively retrain your vagus nerve. You must absolutely invest in a high-quality, clinically validated upper arm blood pressure monitor and track your own numbers in the profound safety and quiet of your own living room, completely bypassing the clinical panic. More importantly, to heal the underlying sympathetic dominance, you must practice structured, physiological sighing or the 4-7-8 breathing method every single day. By deeply inhaling through your nose for 4 seconds, holding the breath for 7 seconds, and forcefully exhaling through pursed lips for 8 seconds, you are literally reaching into your own brainstem and manually flipping the biological switch from the terrified fight-or-flight state directly into the profound, deeply healing parasympathetic rest and digest state, chemically forcing your panicked arteries to release their deadly grip. Moving logically forward, we must confront a heavily guarded, incredibly common misconception that operates as a piece of daily routine dogma, so deeply ingrained in our society that we rarely stop to question the physics of it. The fourth dangerous myth is the completely terrible, entirely counterintuitive advice that drinking less water will actively lower your blood volume and therefore lower your blood pressure. Many older adults, terrified by their high readings and exhausted by the constant need to use the restroom caused by their diuretic medications, consciously begin to heavily restrict their daily water intake. They visualize their arteries as rigid copper pipes in a house, assuming that if they simply pump less fluid through the system, the pressure on the walls will logically drop. What the medical industry completely hides from you is the profound evolutionary survival biology of the human body facing dehydration. When you chronically restrict your fluids, even by a microscopic margin, your blood literally becomes thicker, more viscous, and incredibly difficult to pump. To overcome this thick, sludgy blood, your heart has to beat significantly harder. But the true danger lies in a specific hormone. When your brain detects that you are even mildly dehydrated, your pituitary gland immediately secretes a powerful chemical called vasopressin. The explicit biological job of vasopressin is to aggressively and violently constrict your blood vessels to prevent any further water loss through your skin or lungs. By deliberately drinking less water, you are actively forcing your body to chemically strangle your own cardiovascular system. The unvarnished truth is perfectly hidden in fascinating clinical data reviews that challenge the entire foundational model of fluid dynamics in the elderly. A landmark, highly exhaustive clinical intervention study, published in the world-renowned European Journal of Applied Physiology, analyzed the exact hemodynamic effects of chronic, mild dehydration on the vascular system. The researchers stated an incredibly powerful biological truth. When individuals were subjected to even mild levels of chronic dehydration, the subsequent massive release of vasopressin physically constricted their blood vessels so severely that it actively increased their resting systemic blood pressure by up to a staggering 15%. Let that sink in deeply. The very act of trying to lower the fluid in your pipes actually triggered a massive hormonal avalanche that squeezed those pipes completely shut, skyrocketing the pressure. Picture your beautifully complex circulatory system as a delicate, intricate network of tiny garden hoses designed to gently water a fragile garden. Chronic dehydration is exactly like trying to forcefully pump incredibly thick, sticky, heavy mud through those tiny hoses instead of pure, freely flowing water, causing the hoses to violently bulge, stretch, and eventually burst under the massive, unnatural resistance. Your actionable takeaway here is profoundly simple, entirely free, and deeply healing for your blood viscosity. You must entirely abandon the fear of hydration and strategically flood your system with structured, mineralized water. Because you naturally lose massive amounts of moisture while you sleep through respiration, you absolutely must drink 12 to 16 ounces of room temperature water immediately upon waking, before you consume coffee or any food. However, to ensure this water actually penetrates your thirsty cells, rather than simply flushing straight through your kidneys, you must add a tiny pinch of natural sea salt or a sugar-free electrolyte powder to your morning glass. This explicit combination of pure hydration and vital trace minerals completely turns off your brain's vasopressin alarm, perfectly thins your viscous blood, and allows your heart to effortlessly pump life-giving oxygen through completely relaxed, widely opened arteries. Finally, we must confront the fifth entirely dismissed, highly profitable lie, a piece of morning hygiene dogma so deeply ingrained in our society that questioning it feels entirely unnatural, yet it is quietly devastating your cardiovascular health. The fifth dangerous myth is the absolute medical certainty that your high blood pressure is solely dictated by your inescapable genetics, completely ignoring the microscopic magical molecule that actually dictates the flexibility of your arteries. For decades, the medical industry has heavily promoted the use of harsh, highly chemical, alcohol-based antibacterial mouthwashes, convincing you that totally sterilizing your mouth is the only way to achieve perfect oral hygiene. What they completely fail to understand, or actively choose to ignore, is the extreme chemical brilliance of the enterosalivary circuit. Your blood vessels are entirely lined with a microscopic, fragile layer of tissue called the endothelium. The primary job of this tissue is to produce a miraculous, life-saving gas called nitric oxide, which instantly signals your blood vessels to expand and relax. As we age past 60, our natural production of nitric oxide violently plummets by up to 85%. To survive, our bodies rely on a backup system. We consume dietary nitrates from leafy greens, which are then absorbed by our salivary glands and pushed into our saliva. But here's the critical, utterly fascinating biological catch. Those nitrates are completely useless until they are explicitly chewed on and chemically converted into nitrites by the millions of highly specific, healthy, symbiotic bacteria living on the back of your tongue. When you gargle with harsh, burning antibacterial mouthwash every morning, you literally commit microscopic genocide, completely destroying the precise bacteria your heart desperately relies on to create its own blood pressure medicine. The unvarnished truth is perfectly hidden in massive clinical data reviews that completely challenge the entire foundation of modern hygiene and dietetics. A groundbreaking, rigorously controlled clinical trial published in the American Heart Association's highly prestigious journal, Hypertension, proved a biological reality that shatters traditional medical advice. Researchers found that explicitly consuming high amounts of dietary nitrates, specifically through concentrated beetroot juice, combined with a healthy oral microbiome, actively dilated blood vessels, and reduced severe systolic blood pressure by an incredibly impressive 8 millimeters of mercury. This natural, completely unpatentable, food-based intervention directly rivaled the absolute numerical efficacy of standard, highly expensive synthetic pharmaceutical medications, simply by restoring the body's natural signaling gas. Picture your fragile cardiovascular system as a beautifully lush, heavily cultivated botanical garden that is actively trying to grow the exact specific medicinal herbs your failing heart desperately needs to survive. Vigorously swishing a harsh chemical mouthwash every morning is exactly like aggressively spraying massive amounts of highly toxic industrial weed killer across the entire beautiful garden, completely annihilating the life-saving medicine before it ever has a chance to sprout. Your actionable takeaway here is profoundly simple, entirely delicious, and deeply healing for your suffocating arteries. Immediately march into your bathroom, gather up all the massive plastic bottles of heavily refined, wildly burning, neon-colored antiseptic mouthwashes and throw them directly into the garbage where they belong. You must completely protect your oral microbiome. To actively flood your body with life-saving nitric oxide, you must deliberately incorporate massive amounts of nitrate-rich foods into your daily diet, specifically raw arugula, fresh celery, and deep red beets. More importantly, you must physically chew these foods slowly and deliberately, mixing them thoroughly with your saliva, allowing your natural, beautiful oral bacteria to perform their chemical magic, actively creating the miraculous gas that will naturally and permanently force your rigid arteries to entirely open up and relax. We have covered some truly groundbreaking, incredibly empowering, and historically profound biological territory today. We have pulled back the heavy velvet curtain on the deeply guarded natural truths the traditional medical establishment routinely ignores simply because actual, cheap, cellular healing cannot be patented for billions of dollars in recurring quarterly pharmaceutical profits. We talked at extreme length about the absolutely critical necessity of demanding a massive influx of potassium and natural sea salt, completely abandoning the deeply dangerous, low-sodium lie that actively accelerates cardiovascular mortality. We uncovered the deeply suppressed truth about standard water pills, proving definitively, with hard endocrinology science, that aggressively flushing your system with diuretics actively destroys your cellular magnesium and radically increases your risk of drug-induced diabetes. We revealed the absolutely terrifying, highly intelligent metabolic reality of white coat syndrome, demonstrating how ignoring a highly inflamed, hyperreactive sympathetic nervous system drastically increases your long-term risk of a major cardiac event, making home monitoring and vagus nerve breathing an absolute daily requirement. We systematically dismantled the terrible advice of fluid restriction, proving that even mild dehydration triggers massive hormonal avalanches of vasopressin that violently constrict your vessels. And finally, we completely exposed the devastating myth surrounding oral hygiene, proving that throwing away toxic mouthwash and eating nitrate-rich beets allows your body to create its own miraculous nitric oxide, lowering your blood pressure just as effectively as standard drugs. As we wrap up our incredibly precious time together today, I want you to remember deep in your soul that the most deeply dangerous, incredibly insidious myth you have ever been sold by modern society and glossy hospital brochures is that growing older has to be completely synonymous with physical fragility, vascular decay, and an ever-growing terrifying list of expensive, side-effect-laden pharmacy prescriptions. You possess incredible, vastly untapped power over your own internal biology, and your magnificent body is perfectly, beautifully designed to heal itself and physically thrive when it is finally given the correct nutritional, emotional, and metabolic tools. Getting older should be an absolute, joyous privilege. It should be a wonderful, vibrant time to deeply enjoy the vast wisdom you have rightfully earned over decades of hard work, to travel the world with endless, abundant energy, to actively play with your grandchildren without the constant, heavy shadow of a looming stroke dictating your every move, and to live completely free from the toxic, devastating cycle of daily pills and terrifying monitor readings. You fundamentally deserve to step out into the world feeling deeply protected, intensely radiant, highly confident, and entirely on your own terms. I want to hear your brilliant personal thoughts, your unique health experiences, and your ongoing victories on this continuing journey to better, completely bulletproof cardiovascular health. Please take a moment right now to leave a highly detailed comment down below and tell me which of these massive, paradigm-shifting blood pressure lies shocked you the absolute most, and what specific action step are you going to bravely try first in your own life tomorrow morning. If you found this deep dive, strictly evidence-based, unapologetically honest physiological information valuable, empowering, and deeply helpful to your personal metabolic journey, please hit that like button right now and absolutely make sure to subscribe to our channel because your radiant independence, your long-term cellular health, and your ultimate, uncompromising freedom from a completely broken, incredibly reactive medical system are absolutely worth fighting for every single day of your life. Keep pushing forward, keep aggressively demanding the honest scientific truth from your healthcare providers, never settle for the standard pharmaceutical answers, and always remember that your absolute best, most active, most intensely vibrant, and completely disease-free days are entirely within your control and can still be well ahead of you.